Well, there are calls once again to have hospitals exempt from load shedding, especially now with stage 6 in place. Healthcare workers say the rolling blackouts put a strain on equipment and patients' lives at risk. They say services, including emergency surgeries, can't be performed timeously due to load shedding. So let's bring in Professor Adam Mohamed, who is the head of internal medicine at Maxeke Academic Hospital in Johannesburg. Prof, it's great to have you with us on the program. I mean, it's bizarre that we even have to have these calls, isn't it, for hospitals to be exempt?
Thank you so much. And you're right, the word bizarre sums it up quite apt. I think we're under such immense pressure coming out of COVID, where we're trying to do catch-up, and the number of admissions and severity of disease has exponentially increased across southern Gauteng. Yet we are having the challenges of load shedding. I mean, we can talk about the technicalities of the DB boards blowing up, the overload switches, the amount of money that we are spending at this hospital, for example, when we have load shedding, is between 800 to 900 liters of diesel a day. The figure from Baragwanath Hospital was for over a month, when it was quite intense, was between 5 to 8 million rands a day.
Sure.
A month.
Yeah.
And what people need to understand, this money is coming out of the health budget. So every time we are filling up diesel, we're denying patients care. That's besides the challenges of the electricity goes off, the systems goes off, people are during that day. Sure, there are generators that kick in, but we've had issues with generators delaying startup, and it affects healthcare. Our systems do have UPS, but again, everything has a limited lifespan. We have a neonatal ICU with batteries, but after a while you need still time to charge these batteries, and that's not happening. We're in dire straits, and I must tell you the Gauteng Department of Health are looking into it. I'm just a little disappointed at the speed that we're doing this.
Yeah, absolutely. Professor Mohamed, I can't imagine that the issues around load shedding and the issues that you've outlined insofar as, you know, that delay in the generators kicking in, the wear and tear from power surges possibly to the equipment, I can't imagine that all of that doesn't come with a real threat to life.
Every single time when a generator kicks in, we are always worried about problems with our machinery. And it's a stressful time for all those that are at the job at that time. It has a knock-on effect where you can't even book patients for an appointment, a follow-up to get blood results, because everything is linked to the computers, restarting the system. And in a system that's already under pressure and buckling, I think we don't understand that this is not a luxury that we're asking for. We're asking for a basic necessity. I would like to highlight that Western Cape has this already in place. They've passed the rules and regulations. And we can do this if we put our mindset. When we passed COVID rules and regulations, it was done overnight. So please, going out from myself, from the to the Department of Health, Gauteng Department of Health, and the other departments of infrastructure, to Eskom, City Power, please do what it takes to get the hospitals off. We're talking about the most vulnerable patients. We are playing Russian roulette with their lives. And I think it's not fair, and it would be embarrassing if more and more people die unnecessarily. We couldn't have prevented COVID deaths, but surely we can prevent unnecessary load shedding deaths.
Absolutely, especially because there are certain government departments, places where government officials live that are exempt, that are not load shed. Surely our hospitals can also be put on that schedule.
I agree with you 100%. If you're wealthy, you have a generator at home. It doesn't affect you. If you're wealthy, you have solar power. In the setting of what we're dealing with vulnerable patients, this has to stop. And I think if I can ask all society out there, raise your hands and make a noise. Let's stop load shedding all healthcare facilities, not just in Gauteng, across the country. Let's put a safe zone, a buffer zone. No guns are allowed into hospitals. Let's put no load shedding into the hospitals. Let's save lives. Let's do what we're supposed to do in this country.
So, Prof, there's obviously, from what you're describing, there's pressure on hospital equipment due to load shedding. There must also certainly be pressure on hospital staff to try and do what they can when load shedding does hit and there is that delay in getting the generator up and running and so on?
So if I give you an example, if I come to work and in a place where there is no natural light and the load shedding goes off, the hospital does not have emergency power for the entire hospital. Only red areas will get generator power. So again, don't assume that the generator is kicking the entire hospital is under electrical cover. There are certain aspects in the hospital that don't get electricity. So an outpatient area which is not deemed an emergency, I would be sitting and seeing a patient with the torchlight of my cell phone to examine and see that patient. That patient then goes to book an X-ray. Sorry, system offline, come back another day. For a person who's vulnerable, has to take 2 taxis to get here, take a day off work, can you imagine him coming back another day? I think the practicalities on the most vulnerable, it has an immediate effect and it's going to have a long-term effect both for the individual and for society at large. We need to mobilize to get the hospitals off the load shedding schedule. And I'm sure that there is no person with a reasonable outlook in life that will object to hospitals being put off the load shedding schedule. Yeah,
absolutely. Prof, can you give us a sense, just from the perspective of your hospital, what kinds of backlogs this has resulted in terms of patient care?
So I think at the end of the day, there are challenges with radiology, where we do have condemned CT scans and we're waiting for new scans to be put out to tender. And now you're running with fragile equipment that's already being suspect, and now you're putting load shedding on that with already UPS that have outlived their duration of lifespan. Already the backlog from radiology is ever increasing. And radiology, as an example, is the backbone for whatever we do in surgery, internal medicine. So again, all of these things have a knock-on effect. If there is problems of ventilators with batteries, then you have to have nurses manually ventilating patients. And you can do that for 1 or 2 hours. But as the load shedding number increases, the duration increases, the frequency increases. And morale at this hospital is at an all-time low. Following COVID, fire, COVID, now I should add electricity. So we are losing staff because of low morale. Patients are frustrated. Healthcare workers are frustrated. So the entire system, I think, is crumbling, and it's not unique. Baragwanath Hospital, Helen Joseph Hospital, Laratong Hospital are having immense burden also with load shedding. And remember, load shedding is linked to water supply. So when you don't have electricity, you also have challenges with water supply. And there goes your infection prevention control and spread of infections. And we have seen this in this hospital. When there are problems with load shedding and water, infection rates pick up. So we're not talking a simple thing of electricity. There are so many knock-on effects onto the healthcare and the patients that we have to now become more vocal in saying, stop giving the hospitals load shedding.
It's a life and death call. Professor Adam Mohamed, let me thank you for your time this morning. The head of internal medicine at Charlotte Maxeke Hospital. And of course, it's an issue that impacts hospitals across the province of Gauteng. Prof, thanks very much indeed for coming on to the AM Report.